We're going to go on to the next talk, and I invite Dr. Helena to come and talk about how to improve interactivity in the classroom. Dr. Helena has accepted the invitation to come at really short notice, come really all the way from Portugal for a couple of days. She has been saying that she's going to come for longer because she's very proud of the Goan, the Portuguese heritage part of India. So over to you, Dr. Helena. Thank you so much.
Thank you so much. No sound? Yeah. Thank you so much for, again, Ophthalmology Foundation for the opportunity to be here. Thank you so much for the organization, and thank you to all of you who have joined us today. So this ties with the previous presentation, and we have already seen such exciting ways of using technology to make our message to go across more effectively. I will present a little bit more on the side of not having so much technology on our side. So this is the sad story about lectures. I think we have already gone through this. It's the 7-10 minutes, probably less with the younger generations right now, of attention, and the correlation between what the presenter is stressing and what is taken by the audience, and also the impressive percentage, lower percentage of retainment of the message that can be immediately after letter be presented by the audience. So the objectives are to recognize that active learning expands beyond not only technology. If we don't have technology, there will be other ways of enhancing learning. And we could see in the previous presentation how important it is to have someone who lecturing with active learning, but also that active learning can come so naturally when the presenter is presenting. It depends as well as how much the presenter, the educator, is motivated for the learners to catch the message he or she is intending to come across. And also describing some technology and non-technology assisted active learning strategies. So this is what happens. So it's not a lost case in terms of the lecture. What happens is that we can improve the attention of the audience if we intersperse some bits of active learning within the lecture. And also we have seen this before. It's so much important that at a certain time the participants can have the opportunity to put their hands on either conceptually or in some procedural technique or technology that they can experience, as Professor Prashant was presenting this earlier presentation on the experiential learning. It's so much important, not only the conceptualization, the reflection, but also having the opportunity to experiment. So passive learning is important, nevertheless, for the learning process, and it's perceived, the knowledge is perceived as a transferable commodity. So it's kind of skills transfer, as we usually used to say. Whereas active learning perceives knowledge as an active experience, something that is experienced by the learners, that they have this opportunity to experience, and they can do things and think, not only do things, but also think, so reflect about the things they are doing. This is so much relevant and supports the idea of the Kolbe lecture, experiential learning, theory of learning that we have seen earlier. And also involves intentional engagement, so people are intentionally engaged to learn about something they will be able to apply in their own practice, in their own reality. And also fosters and nurtures curiosity, discovery, communication, and problem solving. So this goes more than just grabbing information, but also putting that information in terms of an experience that can begin at the classroom in a protected environment, but the idea is to transfer that, to apply that, or to mobilize that experience into the real world. Sorry. So when we are thinking about integrating active learning into teaching, we usually can think about these 5 pillar steps. What do we envision, what we imagine that our learners would be doing by being offered the opportunity to do something? What would be the purpose for that exercise? And what would be the teaching strategies that we would use considering these 3 domains of learning? Are we aiming at improving knowledge, at improving attitudes, professionalism, or skills, procedural skills? So we must think about these 3 domains when we are imagining, when we are designing these moments of active learning. And how much time do we have for this? We have, for instance, an hour lecture, and we would like to, just stop 2 moments, for instance, to intersperse active learning. What we would like to emphasize on these moments, and how would we do that? So examples, very simple, no technology involved, thumbs up, hands up, color cards, depending on the questions that we make. But this mobilized the whole classroom to be active, engaged in what is being discussed and explored. Think, pair, share. In big audiences, for instance, this can happen. Sometimes people think that just by having a very large audience, it's not possible to intersperse and to have active learning. We can do that with technology, for instance, with audience response systems. We can do that with Kahoot now, we can do it with Mentimeter, Poll Everywhere, etc. There are a lot of online softwares that we can use, but we can also do this very simple thing, this interrupting a little bit, think about what's being explored, discuss with the neighbor by the side, and then eventually share in the large group. The other is buzz groups discussions. Even in this very large audience, a large group can be broken down into small groups, and these groups would be primed, so to speak, with 1, 2 questions about the topic that is being an exploration to, for instance, problem solving or case-based that can trigger the discussion among themselves. And these groups can start smaller, and then, like a snowballing, it's about these groups becoming larger when they collide. Not collide. they join other groups and make larger groups into the larger group. The jigsaw exercise is very interesting, for instance, when we are interested in providing some active learning based on a problem solving that can be broken down into pieces. And for that problem solving, the groups, the elements of each group, of each home group, can get together with others that will work in the specific part of that problem. And then when they come back and join again their home groups, they will be more knowledgeable about that piece of the problem that, taken together with all those pieces, will arrive at the solution for that case. For example, we have here prevent complications in context of pseudoexfoliation cataract surgery. And we could see, for instance, anamnesis, clinical examination, preoperative care, postoperative care as the expert groups. And when these elements from each expert group join the home group again, they can be better equipped to solve the problem. Gallery walk. So when groups work together, when we saw earlier, they can arrive at some definitions, conclusions, messages, key messages they would like to share in the large group, and the whole large group can do some gallery walking. Role play, very useful, for instance, for soft skills, for professionalism, for communication, and usually mobilizes everyone and makes a very informal learning space to be. Using emojis, using designs, using images for instance, providing feedback at the end of each presentation that can be self-assessed or not. Brainstorming when there's a problem and people work together, for instance, in a large group, and they can have ideas that they can post very simply, and all are engaged, even if they are a little bit more shy or difficult to participate. Other in small groups or in the larger group, they have their idea and post it on this flip chart, as you can see, and then it's very interesting, for instance, to go with these ideas and cluster the ideas into clusters of themes and arrive at some conclusion. This is very involving and engaging for the whole group. And then games as well. For instance, just having some dice and rolling the dice can give the opportunity of different groups working in groups, in small groups, with slightly different case scenarios that can engage the group, as you can see here. For instance, if you have for the type of cataract and your dice roll just says 1, you will have this polar cataract, or for the eye examination, the pseudo exfoliation, and by that, the case scenario will be different for the different groups. And simulation, of course, there is either here is presented as for the procedural, and usually for ophthalmologists, we immediately associate simulation with procedural skills, not only surgery, but usually surgery. But we can also use simulation for conceptual skills, and usually also, for instance, simulated patients, virtual and gamification as well, to create scenarios, providing different cases of professionalism, communication, patient-doctor, etc. In summary, having this is a mindset. It depends a bit of the presenter, but also it can be learned, it can be taught if the teachers and educators are willing to take this mindset and task. Exercises communication, so it goes beyond information, it goes beyond knowledge, so to speak, and also it brings with the other domains of knowledge that are attitudes and also skills, and involves collaboration, problem solving, critical thinking, and not only providing information. Benefits from organizational recognition. Then this is very important. For instance, you have seen that having a fellow or being a fellow is an immense excitement, because it provides you the space and the recognition of the organization that you are doing something that is undoubtedly helpful and valuable for the next generation of ophthalmologists, in our case, to be better providers of eye care. But sometimes this is not the case, and you have to be a little bit as a kind of a spearhead flag for that. And it's so important that sometimes I always remember that image that you have the kind of someone who starts from nothing to, just dancing the beach, and no one understands why that person is dancing on the beach, and dances for a long while, and it starts to be a little bit uncomfortable for the one who starts dancing, because it was so, it was so gray, and it's not fun to be in the beach without having anything to do. And all of a sudden, someone joins, one person, and there are 2 dancing, and then there are 3, 4 snowballing people. But so it's difficult for the first one if you don't have the recognition, but the message is not to give up, and to find someone who can also feel, and you can inspire someone to feel this is important for the next generation of eye care providers, because if they learn well, they will be better professionals. And faculty development is needed, and also the Ophthalmology Foundation with the program of training the trainers, of the programs that Professor Karl Golnick presented. The one that we are having there, this opportunity is also in this framework, and also requires integrated implementation in curriculum. So should be recognized by the organization, and should be kind of a culture, and not only something that just, it's kind of a whim of someone who would like to teach a little bit different. Learn, participate, and create. Thank you.
Thank you, Dr. Helena, for that really illustrative talk. We'll take a pause here and discuss the first two topics that we have covered. So I want to know from the audience, so while I pass on the mic, I want to welcome Dr. Tinku Bali, who has come from the ARC, member ARC, and Dr. Rashmin Gandhi, who is a legendary teacher, known world over. Thank you for joining. So we're going to talk about what technology do you use for your teaching, and also what about how do you bring in interactivity, Dr. KP?
No, mine is actually a question about the second topic, the interaction. See, I teach around 30 students, half of them are DNB postgraduate, half of them fellows. However interactive you want to make it, I find, very disheartening, they're very passive. The present generation, I don't know, I want to just ask the others about the experience. They don't come prepared for the class. Number one, they are okay if somebody else answers. That earlier when we were students, we used to be the first one to raise the hands and answer the question to get brownie points. Nobody cares, because they say they can always go back and probably look it up or something. Presently there is a tendency to be laid back, probably to look at it later, or probably answering a question. Forget about asking a question, has always been a lost art. I just want to know everyone, because there are many people from the medical colleges also, like what has been the present scenario? Is it the experience of all, and what we can do to probably circumvent this?
Give a lot of talks and lectures.
I think most students nowadays are very underwhelmed by whatever we do. I think whatever tools you use, whatever mind maps, they're not like, we used to be overwhelmed by all this, and we used to be so excited, and we used to keep our teachers on a pedestal, although we both are not that old. You're right about the generation gap. And nowadays they couldn't care less, one, and they're not really impressed. They are not impressed with anything. Whatever, you go do theater on the stage and tell them about the walls, they are not impressed. It's very difficult to impress somebody who is constantly needing stimulation. They are, I think, hyper-stimulated by social media, I think, and that kind of dopamine rush is not there, is something I have diagnosed. I think they are underwhelmed by whatever, they are not impressed, no matter what you do. And like Krishna Prasad sir's, exactly, there's no fear of losing information. Yeah, and there is that they don't want to impress anybody. It's like each one is a king and queen, and everybody is a star, and I don't have to impress you. That's why I don't have to answer your question. I think that's something, I remember being like mesmerized by Dr. Krishna Prasad's refraction tutorial. It's like jaw is on the floor. Dr. Rashmin's lectures on neuro-ophthalmology, I can never forget progressive supranuclear palsy, Parkinson plus, I can never forget. That's something, it just gets cemented in your memory, and we were so impressed, and we still are. But now I don't think you impress residents anymore.
I wanted to thank you actually. Okay.
Welcome, Dr. Prashant. Come on, the man behind the show. Yeah, please just say hello to all of us in your busy day.
Hi, good morning, and thanks a lot for being with us. In fact, I should thank the ophthalmology program for being associating with AIOC, and I take the opportunity once more to thank you on behalf of AIOC for associating with us. And naturally, the whole show is being conducted by all these big people, so I don't have to even look into this all. Thank you, thank you. No, I'm not speaking.
Okay. Sorry, I interrupted. Thank you, Dr. Prashant. Anybody wants to comment? How do you impress the
I liked a lot this last intervention because I feel exactly the same, which is the democratization of information and the ease that people get to the information has this side. And it makes us think how much this generation is different, how much we were so attracted by the lecturer, the role model, the mentor that we have and still inspire us, at least me, still inspire me in my clinical activity and educational activity, whatever. And how this new generation, if this is the right designation, thinks about. It's very easy for them to go into the information, images for some clinical problem, even at the OR, and they immediately have some, decision, they arrive at a decision, at a diagnosis, at a management plan, and it's kind of, if it's not needed, which is kind of, just kind of a chilling thing, not learning anymore because the information is there. You just have to grab the information there. And they have this critical thinking in terms of appraising if the information is coming from a trustful source or not. So this is very important when people say, oh, that comes from Google, oh, Dr. Google, but the residents know where they should find information. So what really moves them? What would excite them? This is, I was, for instance, I was listening to Professor Prashant Pranesh, and I was thinking to myself, wow, I learned because I had to learn. I would like to make a good, a good figure of myself, of, just honoring my mentors, and I would like them to trust me, and I would like to, to earn my place. And now we tell them everything. We have to imagine that this is the anterior chamber. So I had nothing of this. And especially when we come to the postgraduate, the residents were responsible for presenting the morning rounds, and they were responsible for that. So this makes us think as how it is going to be, and with artificial intelligence, generative artificial intelligence, and all that. So what's going to be in the future? This is how so much important it is to magnetize their interest to come to these kinds of meetings and spaces that we can speak and explore about health professions education and medical education, so we can learn as well a little bit from them, which can be difficult because once they know, they just fly another place. So it's just like birds flying, and they discover the quiz, and then they just fly away. This is my experience. So thank you so very much for bringing that up, because I think this is something. This is kind of a groundwork that it's needed to be taken in consideration when we are speaking about all these techniques and about if people don't hear those who can. There are still TED Talks, right? So there are still people who can capture attention of others. So in terms of lecturing, so thank you.
Dr. Helena, I think one of the things that caught my attention now was how you mentioned knowledge is so readily available that learning is now less, because all a trainee needs to know is where is that knowledge that they can access. And more importantly, at some level, they are a little more advanced beyond us in assessing, is this knowledge useful? Because I was, yeah, I remember during, so I'm an oculoplastic surgeon, and my favorite quiz question that I always ask all the residents is, in thyroid eye disease, what is this sign? What is that sign? What is Dalrymple sign? What is Mobius sign? And a resident actually asked me, what is the importance of knowing these signs? Why do I need to know what is the name of this sign when I know what it is, when I see what it is? And I didn't have an answer. So they are able to flush out what they feel is important, what is not. And we also need to now be a little more adaptable and flexible in doing that. The other thing that, we traditionally used to have these case presentation where someone would present a case, talk about the signs, the investigations, a diagnosis management, a review of literature, a discussion, a take-home principle, and then the conclusion. Residents nowadays are being very innovative, flexible, and you need to somehow allow that innovativeness and flexibility to express themselves. Like the way Pranesh has broken the mold in how we are presenting. A lot of these guys also end up doing amazing stuff. So like the more we teach, the more we end up learning.
I'll flip the question. If there was no exam for postgraduate, will they read?
They read what they like. They read what they like, what they want, which stream they want to go. But as a holistic
If there is no exam,
approach,
if there is no...
as a holistic or seeing a patient as a whole, I doubt that's
No, will they read for the idea of becoming better?
Dalrymple has to come make a TikTok video and say that.
Yeah, so first of all, thank you so much for flattening my ego, completely saying I no longer impress. But what I think, what Akshay partly mentioned, is it also presents the opportunity. Because we know exactly what excites them. It's like, in one of the talks, what we had discussed is that it's not that they're no longer wanting to watch a movie. It's just that they don't want to go to theater because OTT is available. So they can watch it at their own pace. They can go back, come back. And I think that presents an opportunity to modify our teaching, which they absorb.
I think it all, what I see at home reflects what is happening in the classroom. That is my 25-year-old. 3 or 4 years back, whatever I said was wow and cool, dude, and now it's all meh and mid. There are only 2 words that exist. But inside closed doors, she's all excited and animated. And I asked her, what is going on inside? So basically, I think we need to find out what excites them and what, I don't know, I don't think anything will inspire them, but at least what is something they think is cool and fun. Any more ideas? Helena, you wanted to say something?
No, I really feel that assessment drives the learning. So assessment is required, definitely. They will learn what they want to learn. And one more thing is that they don't have social interactions the way we used to have. Like I just went for an exam, I was an examiner and I was going up in a lift to the 5th floor. I found these young residents surrounding me. They didn't know who I was. And everyone was on a mobile, on social media. They don't greet each other, leave alone anybody. So they're not bothered, they're in there with their mobile. So this is one thing which is very responsible for this lack of attention span or whatever they have. They're glued to a screen all the time. So I don't know. That is quite scary again, because social interactions are not there. Or it's through virtual interaction, but actual physical talking is not there.
I think we just need to change with that and adapt to this. We can't be our uncles and grandmothers and start complaining.
No, we're not complaining, but if you see that, if you want to at least greet somebody, yeah, or something, and most of them are sleep deprived. If you see that most of them are so glued to their screens, they're not sleeping at night. So this is one thing which is really taking toll. I really feel that. So this is...
So one more comment from you, Dr. Helena. We'll go to the next session. Thank you, but point well taken.
That is hands-on, I think still, excites them. Like surgery, for instance, that is the only thing that I've seen when they really, they have that spark of excitement in them. Anything that they get to do with their hands. So, I mean, we should have more hands-on teaching, rather than plain didactic teaching. So I think that's the only thing that's going to spark their interest when they're involved in doing something on their own.
Thank you. Thank you. I take the opportunity to welcome also Dr. Kaushik Murali, young educator from the Shankara system, who again I have unloaded a talk on him, and he's not happily or readily agreed, but thank you for agreeing.
That's a good point as well. And that makes me think if sometimes they are fully aware that they are operating patients and not only eyes, because I can feel they are so light. They are so light. And when we are by their side, we are, when would you like me to? We should switch. Just a little bit more, which is, I think it's food for thought. I think this will not be probably solved today here, but it's something that we should think about in terms of the future, and how this bridge can be built better, because it's certainly a different way of looking at the profession, at looking at the camaraderie in the profession, how the profession can serve my own interests, and how I can learn the best to be, for something that will be a definite outcome in the future, a definite, I would say, output, and somehow outcome as well. So it's about empathy, to be in their shoes and think what would be better to. Probably not everything is good in every generation, and probably again here, and probably something that the older generation, I am the older generation, bring, probably can also be, even if difficult, even if they don't like, but well, we learn this way. This is our story. Probably it will be a good story, and probably will inspire others or attract others. I like inspiration. If they aren't inspired, I can feel a little bit lost.